So the answer is it depends, right? It depends on the waiver, the time limits that are approved. Usually it's a multi-year approach. I don't think I've seen one that's been a single year. They want to create enough runtime here to see what those outcomes will be and then continuously track and report back to CMS on those outcomes. We've seen a number of waivers just continue to get renewed. That's the other thing. When the time limit comes due, if the state believes the program's working, they simply can refile for a waiver renewal. It has to go through public comment again. There's a whole process for CMS to approve it. But those renewals certainly are easier, provided that evidence isn't contradictory to the goals, right? So that's what we've seen with the Medicaid expansion program, for example. It was continued. The waiver was at risk of expiring. The state continued it. Now the state has moved that over into the state plan amendment, into the SPA, as it's called, to formalize it and keep it there without having to continuously come back for waiver renewals. Different administrations at the federal level will dictate some of these a little bit differently as well over time. So we've seen some administrations that have come in that have said they want shorter time frame. They'd rather plans or states keep coming back to renew so that they can justify or verify whether or not there's at least some inclination of success or some signs of initial success before continuing. But if a program's working, I've not seen CMS deny a renewal. So it's more important, at least from my perspective, that we get probably 3 years here to test this, that in the course of those years that we're showing at least some initial success on people increasing access, some of those measures I talked about, ED reductions post-release, in-hospital care, so hospitalizations being reduced post-release. You're going to see some increases in Medicaid services as well, and that's a good thing. Like we've talked about this in the behavioral health space, outpatient behavioral health care should increase for this population once they're out of an incarcerated setting. It may increase in the incarcerated setting as well, as far as the units of claims or the amount of claims being provided or service being provided to the individual in that setting. Those can be positive measures, even though maybe the spend looks a little negative on the balance sheet.